Hi there, Sam Hollins here from Sozo Clinic Leeds. Today I thought I'd talk to you a bit about carpal tunnel syndrome. So carpal tunnel syndrome is a very common condition that affects thousands of people across the UK. It's got a number of different causes, but predominantly we see it in, as I said, slightly older people with arthritis that can cause compression of the nerve as the tissues get stiffer as we get older. But in younger people, we see it in manual workers, people who have had injuries like wrist fractures, people who are pregnant and have a bit of increased swelling in the wrist can get carpal tunnel syndrome for a period of time. And some people just get it without any known cause, but we do commonly see it in people with repetitive jobs that do the same manual activity over and over again, and the nerve gets irritated or compressed. In terms of the symptoms that you might be experiencing with carpal tunnel syndrome, you can get numbness and tingling in those fingers that we've already discussed, tends to be on the thumb side. It can be particularly bad at night as people sleep in a more curled up position. The nerve can become more compressed. Some people notice weakness of grip and they end up dropping things because they can't feel smaller items in their palm due to numbness. But a more severe symptom that we see that people really have problems with is pain. And the pain can radiate into the hand, but also into the forearm. So sometimes people with forearm pain, a bit of pins and needles in the fingers, that sounds like a classical carpal tunnel syndrome. The diagnosis is clinical. It's one of a good history of what you're experiencing with your symptoms and a careful examination to look for other potential causes of your pain and to examine specifically the nerve at the wrist and the nerve higher up to make sure that you don't have a problem with your neck or your shoulder or your elbow, which could also be causing a problem with the nerves lower down in your hand. So the mainstay of the diagnosis is clinical. So coming to see us in clinic is often enough to get a good diagnosis of carpal tunnel syndrome. If we're in any doubt, we arrange nerve conduction studies, which are like testing the electrical signal in your lighting circuit at home, and it looks at the conduction and the velocity of the nerve here and beyond the carpal tunnel and sees whether it's being slowed at this point here, like a tight constriction on an electrical cable. Once you release that tight constriction, the electrical signal flows again and your symptoms disappear. So we can treat it a number of different ways, but we largely divide those into non-operative treatments, which is where we use splinting to try and keep the wrist straight so it doesn't increase the pressure on the nerve. Particularly at night, that's quite a good thing to do for a number of weeks to see if you can settle the inflammation. You can apply cold compresses if you think it's related to temperature or swelling due to pregnancy. You can take anti-inflammatory medicines, and sometimes we recommend a steroid injection into the carpal tunnel itself to reduce any inflammation that might be there due to things like pregnancy or thyroid issues. The final option for treatment if non-operative measures don't work or you've elected to go for surgery is to surgically release the carpal tunnel. And then we've got two different ways of doing that. We can either do it through an open incision in the palm, which sees the nerve throughout its course. It's very safe, it's a very quick procedure, but it does leave you with a scar in the palm, which is absolutely fine. It settles down in the majority of cases over a couple of months, but can be quite sore for those couple of months. Or else we can do it endoscopically, which is where we make a smaller incision in the wrist, which then allows your hand to work afterwards. You don't have an incision in the palm, so you can grip and use your hand. It's the same operation, it's just we go through the wrist, through a tiny little incision and a camera, and we pass the camera up to the carpal tunnel and release that fully to make things more released around the nerve, and then the nerve starts to work.